So Liz initially came to see us about 9 months ago, and we placed her implant about 6 months ago in the area of her lower left molar. When she first came to our practice, she was missing this tooth. And do you remember why it was removed? Did it have a filling, or was it fractured?
Yeah, it was a root canal that had been retreated a long time ago when I was very young. And it had just gone bad and it needed to come out.
So she had her extraction done elsewhere actually, and came to see us with a CT scan in hand inquiring about ceramic implants. And once we reviewed the CT scan and took a look at her clinically and evaluated her tissues, we determined that she was a good candidate to receive a ceramic implant. And the specific type of implant that we used for her was a CeraRoot 16, which is the CeraRoot equivalent of a molar implant. And one of the many nice things about this specific implant is the contours of the implant, where the future crown meets the implant, because the emergence profile is very natural and it makes a cement clean out relatively easy. It's practically like restoring a natural tooth in and of itself. So basically she had the implant placed in September 22nd, I believe. And then we waited 3 to 4 months, and like I was saying, she had the restoration placed roughly 3 months after the implant was placed, and we were doing a checkup on her just to make sure the bite's okay. And one of the important things to stress with any implant, whether it's ceramic or titanium, is that it's nice to have the patients come back to whomever placed the implant to have the bite checked and have the soft tissues looked at. So we always make that recommendation along with an occlusal guard for patients. And I believe in her case she had a Bruxer, an all ceramic crown placed, because she tends to be a little bit of a clencher. And so this crown is a very strong crown, and hopefully it will last her for many, many years of good use and good food.
So what do you remember from the surgery? How was the surgery and the days after?
I was actually really ecstatic with how the surgery went. I could tell from what was going on that everything was ideal for my case, so I was just very thankful. Afterwards, everything was also really great. I mean, I think I recovered as far as being able to function. That same night I had soup, and I was able to, I think, eat the next day. So yeah, I was pretty happy.
Liz was a model patient. One of the things with this particular implant, or any one-piece implant for that matter, is that we recommend wearing an Essex provisional or some sort of provisional to protect the head of the implant from tongue thrust or just chewing and not having food accidentally end up on that side that would put pressure on the implants. And one thing I know about her is that she follows instructions to a T. So, so she did really well with it.
Very good. And comparing the day of extraction of the tooth and the surgery of the implant, do you think it was about the same type of healing afterwards?
From my recollections, I think they were generally about the same as far as pain, and there wasn't that much. I think I've been through a lot with dentistry, so recovering from like a surgery is kind of the least of my worries. I knew it was going to be fine, and it was. So.
We did give you prescriptions for pain medicine. Do you remember if you took any of it or how much you took?
That's right. I didn't even need to take any of the medicines that you prescribed, just in case I had a controlled amount of pain. I didn't have any of that. Actually, yeah.
How did you manage your discomfort? What did you do afterwards?
So I did follow the instructions of trying to place like the ice pack on my cheek, but I think with that I wasn't even completely having to do that often. I didn't have that much pain. I was actually a little surprised. After a set amount of time, I was given instructions of trying to brush and eat regularly on the tooth. So yeah, I did that.
And how does the crown feel inside the mouth? Do you see any difference between the crown on the implant and the rest of the teeth?
It looks amazing. Like when I look in my mouth, I can't tell really the difference. The color match is great. Like, yeah, it's the exact same color as my other teeth. It probably looks better than my natural teeth, so it's awesome. I couldn't ask for anything better.
And what made you choose a ceramic implant instead of a regular titanium metal implant?
So that's like a really big question for me. I did a lot of research on that and went back and forth. But there are maybe two main points for me. One, the issue of the energy flow and all the meridian points. I guess I try to live generally a holistic, or try to follow holistic health principles. So that was one of the points. Just the whole mouth-body relationship was something that I believe in. There could be something to that. Another is I guess I read some things about the ceramic implant doing a lot better with gum tissue around the area, and just the gum tissue receiving it like a tooth, and I really liked that part of it too. There were a lot of reasons actually, but those were two of the main things that really stick out to me.
And when you look at the gum on the outside, on the cheek part, does the implant look healthy? The gum looks pink?
Yeah, I mean, the gums looked great from the start. Like as soon as the implant was placed in, it always looked pink and healthy.
And if you had to have this treatment again, you would do exactly the same? Or you would change something?
Yeah, I would, yeah, as long as, so far with all the options, I would, I'm totally pro CeraRoot and pro zirconia implant, so I would love for me to be able to do it on any other teeth.